Hello, I'm Mateusz Fulton of McMaster University, and today I would like to talk to you about our recent study published in the Journal of Developmental and Behavioral Pediatrics titled Exploring Links Between Prenatal Adversity and Adolescent Psychiatric Risk in a Canadian Population-Based Sample. The quality of the prenatal environment significantly impacts the structure and functioning of the developing brain and may affect mental health in children. Exposure to more adversity in childhood and adolescence has been linked to an increased risk of psychiatric disorders in youth. However, it is not known if being exposed to a greater number of prenatal adversities increases risk in a dose-dependent manner. The primary objective of this study was to explore links between the number of adverse exposures faced during gestation and the risk of a range of common psychiatric disorders in teenagers aged 12 to 17 participating in the 2014 Ontario Child Health Study. A population representative subsample of 2,335 adolescents aged 12 to 17 completed the MINI-KIT, the Mini International Neuropsychiatric Interview for Children and Adolescents. The prenatal adversities assessed included 7 common maternal health problems and included diabetes, hypertension, depression or anxiety, thyroid problems, UTI, vaginal bleeding, and influenza. We combined these individual problems into a cumulative risk scale with scores ranging from 0 to 7, creating an index of the number of prenatal adversities to which teens were exposed during gestation. We examined links between this count of prenatal adversity and psychiatric diagnosis in adolescents using logistic regression, in order to attempt to isolate the effect of amount of prenatal adversity on offspring mental health. We statistically adjusted for the age and sex of the adolescent, as well as familial socioeconomic status, current maternal mental health, and maternal age. We found a dose-dependent association between the number of prenatal adversities faced during gestation and the risk of ADHD, GAD, and social anxiety disorder in adolescents. Exposure to each additional prenatal adversity was associated with a 29% increase in the odds of ADHD, a 27% increase in GAD, and a 35% increase in social anxiety disorder. These associations persisted even after adjustment for age, sex, socioeconomic status, maternal mental health, and maternal age. Put another way, if a mother experienced all 7 gestational complications during pregnancy, the risk of her offspring developing ADHD would be 3 times higher than if they had none. They would also be 3.5 times more likely to develop social anxiety disorder and nearly 3 times as likely to have generalized anxiety disorder. Using data from over 2,000 teens born in Ontario, Canada, exposure to increasing levels of prenatal adversity is associated with an increased risk of ADHD, GAD, and social anxiety disorder in adolescents in a dose-dependent manner. These results suggest that exposure to maternal health problems during pregnancy may affect the physiological systems mediating threat detection or vigilance, as well as reactivity or responsivity to threat. Although we had access and utilized structured psychiatric interviews, the observational nature of this study does not permit conclusions of causality. However, these results suggest that teenagers exposed to increasing levels of maternal health problems during gestation may benefit from closer monitoring and the application of early interventions to prevent and treat mental health problems should they begin to emerge.